All right, we are back here with John Higgins, VP of Talent Management from Essentia. Now, John, I don't know how it works in Fargo, but people are generally averse to change.
Yeah.
The change that you made to go from how it's always been done
Yeah.
to these new initiatives. There are a lot of people watching that are like, I want to do this stuff.
Yeah.
But the powers that be don't want to do it. They don't want to change how things are done. Talk about the process of how you got buy-in.
I think a lot of it very simply is around, what's the business case, right? And putting together a very clear understanding of, what's the current problem you're trying to solve? What are the barriers that are getting in your way? And how is the solution you're bringing to the table going to solve for that? And then ultimately, how is that going to translate to an improved savings, improved, revenue scenario, improved, patient experience, patient care? Those are the items that that sell to our executive team. I can't tell you the number of what we call S-bars that we have had to write. S-bar is a form of a business case, if you will. So situation, background, alternatives, and what's your recommendation? We've gotten really good at it, right? And so it may be too good at it, such that I sense there's a little bit of envy in how well we've been able to bring those things to the table and ultimately drive the solutions that we need. But if you get momentum every time you put a new solution in, and it produces great results, and you get a great return, the next time you go back to ask again, there's not the same resistance, right?
You said
get it right the first time.
You said table, and we've been hearing for decades, HR wants a seat at the table. Like, how comfortable is your chair now at that table?
Now that I've done it, incredibly comfortable. I can tell you, when I walked in the door, it was anything but comfortable.
Well, they know without you, they don't have services.
Yeah, correct.
They need those people.
Yes.
They can't provide the services.
That's right.
And they can't play on those thin margins without the people.
Right.
AKA out of business.
Yes. Right. And you can't improve the margins without driving out things like travelers, right? So you can't improve them enough, right? That's a really, your two biggest costs as it relates to healthcare are your labor, right? Labor costs, supply chain cost. That's it, right? And then unfortunately, the other thing that plays in there, just for what it's worth, what's your reimbursement rates, right? And unfortunately, right, things like Medicare, Medicaid reimburse us somewhere between 60 to 70 cents on the dollar, right? And so with roughly 60% of our patients coming with Medicare, Medicaid as their insurance, you can understand real quickly why our margins are where they are. With only 40% of our populace at the moment, coming in with private insurance, your margins are much more tight than they've ever been, especially in nonprofit healthcare.
Well, let's talk about the leaky bucket syndrome, though.
Yeah.
Right,
Yeah.
because that's huge in healthcare,
Yeah.
right? And again, if you're bringing them in on the front end, talent acquisition and talent management, you're losing them on the back end. Again, it's just the leaky bucket. So how do you focus on? We're talking about candidate experience.
Yeah.
What about employee experience?
Yeah.
Right?
Yeah.
Can you talk a little bit about that and
Yeah.
how technology is helping with that? And
Yeah. I'm not sure technology is helping enough yet, right? That is actually, kind of our key next focus. But what I would tell you is we've gone from a place where we've been talking, when I first got there, right, about 3 years ago, recruiting's a problem, right? The discussion has completely flipped to retention's an issue, right? And so I've got really incredible business partners, from our chief nursing executive, chief operating officers, the presidents of the markets that we work at. They get it, and they're focused on how do we engage our talent, how do we empower them, and what do we do to make sure they don't leave us, right? It used to be a bad thing to look at, to have somebody leave your department and go to a different department, to elevate what they were doing to do something different. We're at a place where, one, that's promoted, and you're, as a leader, the more you're able to promote and grow your talent, the higher you're seen in the organization in terms of favor, if you will.
That's awesome.
Yeah.
What are some of the tools? You mentioned some of the tools on the recruiting side, but from onboarding to engagement, referrals, what are some of the tools and techniques that you guys are using that are successful?
Yeah, so the right now, to be really transparent, most of what we're using, are Workday-enabled tools, right? It's things like the Talent Hub, right? Using the capabilities within that tool, from performance and development conversations, to succession planning, all those things baked into that tool. I would not tell you that those are necessary. It's a little bit like recruiting, right? On a scale of 1 to 10, they're probably a 6 or a 7, right? Do we want tools that are 9s and 10s to work with? We do. And in time, that'll be where we go next, right? In terms of next level of investment, where do we, what are the right things to be able to plug into Workday to really optimize that experience for our candidates and our more importantly, our internal employees?
Yep.
Yeah.
Curious about the branding side. We talk about candidate experience a lot. What has that meant to the brand to make it easier, to be more personable through the recruitment experience? And also curious about the competition, because I know in local regional areas, there's 2 or 3, 4, 5 hospital systems.
Yeah.
And that, it's just like swapping spit.
Yeah.
How has the candidate experience changed some of that for you?
The good thing for us is there's often not, 3, 4, or 5 because of where we operate. But there is always competition, and really good competition. It's typically 2 to 3 vendors in a given market that we're going up against materially. We know we're getting better market share based upon the results that we're driving, right? That increase in candidate flow. I have peers that I know, that work in the other organizations that, we have conversations and, they're well aware of the fact that we're, having more success than we did historically. We're much more competitive than we've ever been before. Ultimately stealing more talent than we used to, right? More talent's deciding to come our direction than go their direction, whether it's folks that are coming right off campus, right? So we're winning more on campus than we ever did before, but we're also winning more in the community in terms of nurses, radiologists, respiratory techs that want to make the change and be a part of, the operations that we're driving. And part of it is not just the, making it easy for them to do it, but what they're hearing about the experience of once you get there, what's going on from a leadership perspective within that organization to drive that retention, drive that engagement. Those are the things that are making a difference.
It's got to be a draw for a kid coming off campus.
Yeah.
To be able to see that, wait a minute, these guys are actually using technology.
Yeah.
To be able to handle this. And I mean, and that to me has, I would think, has that impacted really your campus?
Yeah.
I guess you could say the way that you go after campus.
Absolutely, right. I think that the fact that that the kids can engage in ways that are meaningful to them, right? Make it easy for me to interact via text. Make it easy for me to interact, with videos that I can watch on my phone. Those types of things. All those things play through, in a way that drives more talent our direction than what we've seen, historically.
That is John Higgins, everybody, VP of Talent Management at Essentia. John, for our viewers that want to know more about you or maybe even apply to a nursing job, where do you send them?
You can find me on LinkedIn, JL Higgins on that particular site. But the other opportunity, obviously, is go to our career site, right? EssentiaCareers.org.
Getting higgy with it. Chad, that's another one in the can. We out.